I hereby declare a state of public health emergency, granting me the necessary powers to make decisions quickly to address the immediate medical needs of the nation.
What if I told you that an entire nation's lifeline just snapped overnight? Not because of war, not because of a natural disaster, but because medicine, the most basic right of survival, simply disappeared. This is not a scene from a dystopian movie. This is Botswana in 2025. And the world is looking away. Right now, in hospitals across Botswana, mothers are walking in with children burning from fevers and walking out empty-handed because there are no drugs left to give. Doctors are standing in emergency rooms, helpless, staring at patients they cannot treat, forced to postpone even life-saving surgeries. Shelves that once carried medicine for cancer, hypertension, diabetes, tuberculosis, HIV, and malaria are bare, not low, not limited, empty. And the reason is as shocking as it is heartbreaking. The United States of America, once Botswana's biggest supporter in the fight against HIV, malaria, and tuberculosis, has cut aid so deeply that the country's fragile medical system has collapsed. Before the cuts, Washington funded a third of Botswana's HIV response and poured millions into the fight against deadly diseases. But that lifeline is gone. UNAIDS confirmed it. UNICEF is sounding the alarm. And Botswana's president, Duma Boko, has been forced to declare a full-blown national public health emergency. This is not just about missing pills. This is about a broken supply chain, a shattered economy, and a nation being pushed to its knees. The crisis is being fueled by something even darker. Botswana is one of the world's biggest diamond producers. For decades, diamonds funded schools, hospitals, and government programs. Diamonds were Botswana's pride. It's sealed against poverty. But the global diamond market has crashed. Prices have nosedived, demand has fallen, and suddenly the shining stones that built the nation have lost their power. 80% of Botswana's foreign earnings vanished with the slump. And with that, the government's budget dried up. Now combine that with US aid cuts, and you get the perfect storm. A nation with no money, a nation with no medicine, a nation left to fight for survival. The result? 1 in 5 children in western Botswana, near the Namibian border, is underweight. Not because of famine, but because their weakened bodies, untreated for infections, cannot fight back. UNICEF has called for urgent action. But the question is, who's listening? In a televised address, President Boko stood before the nation and delivered words that sent chills across Africa. The medical supply chain, as run by central medical stores, has failed. This failure has led to a severe disruption to health supplies countrywide. Imagine hearing your own president admit that the entire medical lifeline of your country has collapsed. Hospitals are postponing surgeries. Patients with cancer are told to wait, knowing every day lost is another step closer to death. Mothers with asthmatic children are being told there are no inhalers. Men with diabetes are watching their blood sugar rise with no insulin in sight. And the most terrifying part, prices for the few medicines still available have skyrocketed. Drugs that once cost $1 now cost $10. Basic antibiotics have inflated 5 to 10 times their normal price. Ordinary families, already struggling in a shrinking economy, are forced to choose between food and medicine. It's not a choice. It's a death sentence. The government tried to fight back. The Ministry of Finance rushed to approve $18.7 million in emergency funds for medicines. The military was deployed to oversee shipments from the capital, Gaborone, sending drugs to the most deprived rural areas first. But the truth is harsh. This is a band-aid on a bullet wound. President Boko himself admitted it. Under the current economic conditions, this scenario is not sustainable. And the numbers prove it. The health ministry already owes $75 million to private health facilities and suppliers. Even if emergency shipments come, they won't be enough. This is not just a shortage, this is a collapse. Think about this. Botswana, a country hailed for decades as Africa's diamond miracle, is now begging for medicine, while its people die not because diseases are unstoppable, but because the shelves are empty. The tragedy is made worse by the cruel irony of history. Botswana discovered its vast diamond reserves right after independence in 1966. Those diamonds were supposed to secure the nation's future, to shield it from poverty, to make sure crises like this would never happen. But in 2025, diamonds can't save lives. They can't stop a child from dying of tuberculosis. They can't treat a mother battling cancer. They can't replace the aid that once kept Botswana's hospitals alive. And here's the part that should terrify all of us. Botswana is not alone. It's a warning. If aid can vanish overnight, if global markets can collapse in months, if a health system can crumble in weeks, then no country is truly safe. Imagine this happening in other nations dependent on a single export. Imagine it happening in countries where US aid was the only barrier between survival and catastrophe. The ripple effect would be devastating. Right now, in Botswana, the military is not fighting a war. It is delivering medicine. Soldiers are not carrying rifles, they are carrying boxes of drugs, the new weapons of survival. But here's the truth no one wants to say out loud. If something doesn't change, if help doesn't come, then the graves will open faster than the shipments can arrive. Botswana has declared a public health emergency. But what does that mean in reality? It means a nation on its knees. It means hospitals reduced to warehouses of suffering. It means children crying in pain, not because the cure doesn't exist, but because the cure is out of reach. And it all began with a decision made thousands of miles away, in Washington. A pen stroke that cut off millions in aid. A decision that has now left an entire country gasping for air. The question now is brutal. How many lives must be lost before the world pays attention?
This is not just about Botswana. This is about how fragile nations really are. How quickly hope can turn into despair. How one crisis, diamonds collapsing, aid disappearing, supply chains breaking, can trigger a national emergency that no leader, no budget, and no army can solve. The people of Botswana are resilient. They've survived droughts. They've survived poverty. They've survived HIV. But this time, resilience is not enough. This time, the shelves are empty. And when the shelves are empty, even the strongest spirit cannot fight alone. What we are watching in Botswana is not just a health crisis. It is a silent war. A war where the enemy is not another nation, but the cold reality of economics, politics, and indifference. And in this war, the casualties will not be soldiers. They will be the poor, the sick, the children. This is how nations collapse. Not with bombs, not with guns, but with silence, with empty pharmacies, with a mother whispering to her child, "There is no medicine." The world may see Botswana as just another African country, but listen closely. This is not just their story. It could be anyone's story. Yours, mine. Because when medicine becomes a luxury, when survival depends on foreign aid, when health is tied to politics, then every one of us is vulnerable. And that is the chilling reality unfolding right now. Botswana is the warning siren. The question is, will the world hear it before it's too late? But here's the truth no one wants to face. This crisis in Botswana isn't just about medicine, it's about power. When aid is cut, when lifelines vanish, it isn't just an accident, it's a statement. a signal to the world that some lives matter less than others. For decades, Africa has been treated as a testing ground, dependent on foreign aid, dictated by outside powers, told what to do, and left scrambling when those powers suddenly turn away. Now, Botswana is feeling the full weight of that dependency, and the lesson is brutal. If you build your survival on someone else's mercy, you will always live on the edge of collapse. Think about the irony. A nation rich in diamonds, sitting on billions in natural wealth, yet can't beg for antibiotics. A country that feeds the global jewelry market, yet cannot feed its own hospitals. This is not just a medical collapse. It's a betrayal of sovereignty. Because what good is independence if you cannot protect your people when the shelves run dry? What good is pride when children die because insulin costs more than their families earn in a week? And yet the silence is deafening. Where are the billionaires who profit from Botswana's diamonds? Where are the Western governments who preach about human rights? Where are the global institutions that claim to stand for justice? Botswana's pain is being met with shrugs, with empty promises, with headlines that last a day, then vanish. But for the families living through this nightmare, there is no escape. Picture this. A father walks miles to a rural clinic carrying his son who cannot breathe. He waits in line for hours, only to be told the inhalers are gone, the shelves are bare, the only thing left is despair. Or a mother battling breast cancer, once hopeful because treatment was available. Now she sits at home, her pain growing worse because the chemotherapy she needs has disappeared from the hospitals. These are not statistics. These are lives. And each life lost is a reminder that this is not just a crisis, it's a collapse of humanity's conscience. The question is no longer whether Botswana will survive this storm. The question is whether the world will care enough to act before it's too late. Because if nothing changes, Botswana's tragedy will become Africa's warning. A warning that no nation is safe when survival depends on politics, markets, and the whims of power. And maybe that's the most terrifying truth of all. This crisis in Botswana isn't just about Botswana. It's about us. It's about how fragile our systems are, how quickly stability can shatter, how close every nation is to the edge, no matter how rich, no matter how proud. Botswana is the mirror the world doesn't want to look into, but the reflection is clear, and it is terrifying.